So the fissure in ano is nothing but the linear laceration, linear vertical laceration at the anal verge. So the presentation will be pain is present during defecation. The pain is present. It occurs due to the spasm of sphincter. Constipation. Because of the spasm of the sphincter will cause us the constipation, and constipation will cause us the chronic fissure. So if we see the bleeding, a line of blood by side of stool is present. Few drops of blood at the end of defecation. Diagnosis. As it is a painful, we should not do the PR for rectal examination. No, should not do the proctoscopy. Just we have to do the local examination. On the local examination, we see the fissure. If we look this as a clock, this is the anterior and the posterior. Patient is on the supine posture. This is 12 o'clock and 6 o'clock. We can see the fissure at 6 o'clock, then the 12 o'clock is the most common site. Next, other investigations, treatment for, if we see the treatment for the acute fissure, this is the acute fissure. The treatment for the acute fissure, it is conservative. We have to give the antibiotics and analgesics, laxatives, sitz bath, and the ointment that is of 2% xylocaine and 0.2% nitroglycerin and botulinum toxin injection to decreases the spasm. Next, chronic anal fissure. Chronic anal fissure, it is termed as, if it is more than 2 months of duration, it is termed as a chronic anal fissure. If you see that, this is the anus, and we can see here the fissure with the scarring, uneven edges, and at the end we can see the sentinel tag or the sentinel pile. Pile doesn't mean that it is a hemorrhoid, it is a fissure. And we can see the hypertrophied anal papillae. So if you see in this picture, so this is the chronic anal fissures with the scarred or the hipped up edges and the sentinel skin tag, and also the hypertrophied anal papillae. Treatment for the chronic anal fissure, it is the surgery. So which surgery we need to done? It is the, as it is main problem, it is a spasm of the sphincter. We have to do the sphincterotomy need to be done. Sphincterotomy. Which sphincter? It is the internal anal sphincter because it is an involuntary. So internal sphincterotomy. At what position? So internal anal sphincter, it is a get cut at the 3 o'clock position. So it is a lateral. So lateral internal sphincterotomy at 3 o'clock position. So with or without fissurectomy, we can do fissurectomy or not. It's other surgery. It is the Lot's dilatation. Here we stretch the sphincter under the anesthesia using the 4 fingers.